It's Adrian Cat from Advanced Dental Artistry. Smile makeover for mature men. Well, we know that smile makeover is sometimes always associated with women coming in to get treatment, but as men get older, like myself now getting close to 50, is that we see a lot of wear and breakdown in the mouth over decades of use. And with all teeth, what we normally find is that as teeth wear down, they tend to get shorter. We see a lot more cracks. We sometimes see patients actually missing maybe 1 or 2 teeth. And there's usually a lot of work that's already been done. They've had either silver fillings done when they were a child, maybe some of them ended up being changed over to white fillings, and from white fillings came maybe crowns and porcelain. And over time, there's been a lot of dentistry done, but it's been kind of haphazard. There's been patched up work, there's been crowns done, sometimes large fillings done, and the mouth has actually altered a lot. I'm going to go through the case today of John. He's actually come in, we gave him 2 options for treatment. One was just a smile makeover where we were working on just his smile, and the other option was a smile maker of all of his teeth. So we're going to do all of his teeth today, and I'm just going to work you through the case and just explain how we actually did his treatment, and I'll catch up with you at the end. This is John actually at his first visit, and this is his mouth just at rest. We can see now this video of actually John is now smiling, but you can see actually the aesthetics on his front teeth and how when you look at his front teeth actually they are a different length, and they're also very dark at the necks of the teeth themselves. When we look in the mouth, there's actually a lot of old silver restorations, and these are very, very large. On the lower, there's actually a missing tooth here, and you can see that he's overloaded the back molar, and that molar has actually fractured due to the missing teeth. When you look from a side view, of course, you can now see the missing tooth, and you can see all the roots that are now exposed, plus all the large restorations that are placed. He's actually had a lot of dentistry done. He's got some old crowns, some old porcelain, some old silver fillings, white fillings, and of course the missing tooth there on the side. On the other side, you can see exactly the same thing, just heavily filled teeth. On the front here, you can actually see the old porcelain restoration. These are all metal, so these are actually metal porcelain crowns with porcelain over the top. And you can see how the margins have all discolored, and these were the traditional type of crowns that were done. And over time, due to gum recession and actually changes, you can see the dark margins. And this doesn't happen with the newer full porcelain crowns. There's a lot of gum recession, and you can see that his bite or his lower teeth are all on a different plane, meaning that they're not actually leveled. From a close-up view, you can see that on the margins of these old crowns, you can see that there's gaps everywhere. The lower foundations of the teeth are actually quite good. There's actually some gum recession around, but his general health is actually very good of his gums. There's just a lot of gum recession happening. This is actually the front view that we're going to use for our digital smile design, and you can see how we've drawn a lot of lines on John's face in order to actually plan where his final cosmetics should actually be. This is when we actually create a new bite for John. He's lost a lot of height on his teeth. We mentioned that his lower teeth, the plane of his lower teeth were not correct. So what we've done at this stage is we've actually used just a temporary material on the top of the teeth to actually redesign the actual bite. We're going to test this for a while to make sure this is fine. This is to give you a very close-up view of what the bite actually looks like and the level of the teeth. And when I get John to actually bite up, you can actually see the difference actually here with his bite. All the teeth are actually touching on both sides, and this is now a very balanced bite. From here, what we're going to do is we're going to numb John up and do what we call the trial smile, and these are actually photos of John after his treatment, and you can see he's numb at the moment, but he's actually just going to have a look at his smile and to see what's actually going on. From here, he's actually got quite a numb lip, but you can actually already see the changes. We actually do a review appointment, so this is his trial smile. You can see here his teeth are very aligned, and we then reanalyze the trial smile. That's quite a funny photo of John, just reanalyzing his trial smile to make sure the plane of his teeth are actually correct. Libby actually comes in to do a final shade matching of his teeth to make sure the shade of his teeth are fine, and we're really trying to get a very natural color for John here. We don't want it to be Hollywood white, of course, and we also want John's input to the final color of the teeth. This is the upper porcelain now completed, and you can see the texture and the shading that Libby's actually done to create this. This is a very natural looking case where you can see a bit of staining, some characterization of the teeth, and this is when we're going to bond the teeth in. You can see we're very particular about isolating the mouth, making sure there's no moisture, saliva or any contamination of the teeth before we actually do the bonding. This is actually John just straight after. Now you can see he is actually numb. And then we're actually going to go back now and actually just have a look at John and the changes that have actually happened with his cosmetics during the process. That's John's smile. You can see a before and after picture here. You can obviously see that he's had a bit of a haircut here. He's of course wearing glasses, but you can obviously see the changes in his mouth and the impact that the cosmetic dentistry has actually done. Well, thanks for watching John's case. And John's actually a very typical case where he didn't really know what the end result was going to be like because he didn't think that we could improve his cosmetics very much. It was a very dramatic change actually when you saw him at the end, especially his before and after video here, where you can see such a dramatic change with not only his teeth and his smile, because yes, that does look better, but you can see that it has made a difference to his face because we have added some height to his lower third of his face. But you can see even with a bit of a haircut and a change, he looks like a different man. Well, thanks for watching. If you have any questions, please give us a ring at 1-800-SMILING.